Hi, my name is Michelle. I'm a tutor for Chegg Tutors, and I usually tutor in English, math, and psychology. And so today we're going to be talking about a disorder called anorexia nervosa. Anorexia is an eating disorder often characterized by low weight, a fear of gaining weight, a strong desire to be really thin, and a habit for food restriction. And so there's many symptoms that one might find in an anorexia patient, but here let me list a couple. So people with anorexia refuse to maintain a normal BMI. And they also might have this symptom called amenorrhea, which occurs after prolonged weight loss. And it causes menstrual cycles to stop, it causes yellowish, unhealthy skin, and sometimes causes brittle hair. People with anorexia also often carry a fear of even the slightest weight gain, and they go under obvious rapid weight loss of at least 15% under the normal body weight. They may also show lanugo, which is they're these fine hairs that grow on the face and the body. And they also often obsess over calories, over fat content. They have food rituals that where they cut food into tiny pieces. Some patients with anorexia will force themselves to vomit, or they'll use laxatives to further elicit weight loss. Others will extensively exercise. And patients with anorexia might also carry chronic fatigue, mood swings, depression, low body temperature, and there's many more symptoms that come along with this disorder. So anorexia is highly heritable. Twin studies show that both identical twins are more likely to be affected than non-identical twins. And cultural factors are a huge role, especially in societies that value thinness. So much like our country, the United States, we have constant exposure to the media, which feeds us body ideals that constitute risk factors for body dissatisfaction. And so there are complications that come with anorexia. One common one is a disease called osteoporosis, which is characterized by unhealthy and breakable bones, infertility, heart damage, and more. Another disorder that commonly occurs with anorexia is OCD, obsessive compulsive disorder, and as well as body dysmorphic disorder, BDD. And so treatment involves a restoration to a more healthy weight. We also like to treat underlying psychological problems. So many people with anorexia also have depression and anxiety. And so when we medicate anorexia, we don't medicate the disorder usually directly. We're actually trying to medicate or help with the depression and the anxiety. Anorexia, however, has a really high mortality rate. It has actually the highest mortality rate of any psychological disorder. It's about 11 to 12 times higher than expected. And not all people recovering from anorexia ever recover completely. A third of people go through relapse in the first half year. So that's a little bit about anorexia nervosa. I hope you enjoyed the lesson. Have a good night.